Namaste, good evening, and welcome to all to the 35th episode of Easy Ayurveda Gurukula. So today we have with us Dr. Sampath Nayak. I also have the privilege of welcoming him to the session. He'll be the guest speaker for today's session. On behalf of Easy Ayurveda and all of us, I extend cordial welcome to Dr. Sampath Nayak. Dr. Sampath, welcome to Easy Ayurveda Gurukula. Namaste.
Thank you, sir. Namaste, sir.
So before handing over the dais to Dr. Sampath, I would like to give a brief introduction of the guest speaker, Dr. Sampath. He has graduated from Government Ayurveda College, Bengaluru, Bharat, and so he is currently pursuing second PG post-graduation studies at Department of Kai Chikitsa A.L.N. Rao Ayurveda Medical College, Koppa, Chikmagaluru District, Karnataka, Bharat. So he has assisted and conducted the procedures like Vamana, Agni, Kama, Siraveda, Basti procedures, very much inclined towards clinical practice, and also is a good orator. So today morning he was telling, yesterday evening or today morning, so he was telling while I was on conversation on the phone that the subject which I don't understand properly, it is very difficult for me to convince somebody else on that particular topic. That's why I go into the depth of the subject and explore the Samhitas. Exploring the Samhitas and reading them in detail and understanding them, especially the terminologies, fascinates Dr. Sampath. So continuing the introduction, so has attended basic life-saving support BLS workshop, papers presented. Many papers he has presented at national and international levels. So some important papers being at the national level on Yava, the delicious patya, a boon to diabetes and obesity, a critical analysis of Deepana in Grahani. Another topic, important topic, is Daiva Vapashraya insights of Kadira in Kusta. So one important paper is presented at the international level is Anupana, a unique approach in clinical practice. Related to this particular topic he'll be speaking today. So he is working on his thesis, a single-blind randomized comparative clinical study to evaluate the efficacy of Iranda Saptakakwata and the Rasunodikwata in the management of Stabdata and Ruja associated with Amavata. So today Dr. Sampath will be presenting to us on a very important and relevant topic, relevance of Anupana in clinical practice. Without wasting any time, I would like to hand over the dais to Dr. Sampath. Dr. Sampath, all over to you for the presentation.
My humble pranams to all the Vaidyas present in this platform. And I am thankful to Easy Ayurveda community, and I am thankful to my Guru, Dr. Raghuram sir, for his guidance. Today I am presenting a topic, relevance of Anupana in clinical practice. Before going to concept, I am taking one example so that we can understand Anupana concept. The example is very delicious, that is Pani Puri. If I am making homemade Pani Puri, I require puri, boiled and smashed potato, boiled peas, sweet and sour pani, also salt pani. These are basic ingredients for making food tasty. Pani Puri is a chaat. It's not healthy. Everybody will say that. But as Ayurveda Vaidya, it amused me that who did this kind of combination? If we keenly observe the chat, it's kind of healthy because the guna or attributes of each food ingredients, if you see potato and peas, which are vatakara, increases vata dosha, and sweet sour pani and salt pani, which is vatahara. So there are 6 types of rasas in Ayurveda. 3 rasas, those are first 3 rasas: madhura, that is sweet, amla, that is sour, and lavana, that is salt, which are vatahara property. Usually we drink pani with stuffed puri, or after eating stuffed puri we drink. So here the pani helps in easy ingestion and increases taste also, which has opposite quality to the stuffed puri. So Anupana is same concept of drinks which are taken along with the food or after food, and importantly which should have opposite quality of the food. Now we understand the concept with individual word meaning. So Anupana Shabda has 2 words, Anu and Pana. Anu means after, along with, or near to, and Pana is a drink or a protection. Nirukti. Nirukti means a definition about the concept. Anupana is defined as Pana which is taken immediately after Aushadha or after food, and also Aushadha Yoga or formulation or combination of the drugs, and which should taken according to the vidhi, means which is very specific to the doshas, also which is specific for the diseases and specific for different rutus and different based on individual needs for the patients, and also which is very specific for the different aushadhas also. Sahapana. Here, Anupana and Sahapana, usually it is used synonymously, but Anupana is any drinks which is taken after the food, and Sahapana, it is considered as taken along with the food. So the liquid form which is taken along with or mixed with the main drink, that will facilitate the easy disintegration, easy absorption also. And the references. So where we get references for Anupana. So in Ashtanga Hridaya Sutrasthana, Matra Shiti Adhyaya, in Sushruta Samhita and Charaka Samhita, Sutrasthana, Annapana Vidhi Adhyaya. There is one story which is mentioned in Vaidyakiya Paribhasha Pradeepa, that the story tells that two Rakshasas made Agastya Muni to eat Mamsa Ahara. So the Agastya Maharshi, who had capacity to digest anything due to his ferocious nature, himself needed to take Anupana to digest the Ahara. So the moral of the story is no food can be easily digested without being helped out by the Anupana. What are the guna karmas of the Anupana? What are the effects? So I have classified effects of Anupana on Ahara, on Aushadha, on different diseases, and also on Swastha or healthy person. So effect on Ahara, it helps to draw the ingested food inward easily and split the hard mass of the ingested food. It moistens the food, it softens the food. Also, it helps to completely digest the food. If you see Anupana effect on Aushadha, medicine quickly spreads all over the body, enhances the properties of the medicine, spreads within fraction, and helps in circulation of the drug. Effect on Vikara. Anupana does, it mitigates doshas and separates the combined doshas in the body, overcome thirst and overcome tiredness, enhances the properties of the medicine. And effect on Swastha. So here we have to understand the effect on Swastha as, so by taking Anupana, it will help the completely digest the food, so that the effects like Tarpana, Prenana, Brahmana, the Swastha Purusha can get these kind of effects. And factors to be considered for selection of Anupana. So these are 5 factors. Before administering any Anupana, we need to keenly observe these factors, that is dosha, aushadha, medicine, vyadhi is diseases, rogi, base, individual to the patient, and ahara. How Anupana should be. So Anupana or Sahapana should increases the effect of medicine. Also, it should increases the Roganashak effect of the drug. So if proper Anupana is not being told, then any food can be taken with madhu or water, and also the any medicine can taken with madhu also. Karmukata of the Anupana. Karmukata means mode of action. Before going to individual Anupana example, for better understanding, we will see how Anupana acts, or in what ways Anupana acts. So Karmukata means the mode of action, or here it tells that as the drop of oil put on the surface of the stable water spreads so quickly, similarly Anupana spreads throughout the body. The mode of action we can see clearly as the Anupana acts as adjuvant, it acts as vehicle, and it acts as digestant. Also, it acts as appetizer. It will give synergistic effect. Also, it enhances the bioavailability of the drug. Adjuvant. Adjuvant means assisting or aiding. Here, for example, honey. So it contains easily digestible fructose. So it aids easy absorption by active transport. And inorganic metallic complexes or rasaushadhis, so that are made easy for accepting by the body. For example, we can take rasaushadhis with ghrita and honey also. Also, it is ruchikara. It increases the palatability. So vasa swarasa, it is given in asthma condition. So it has very bitter taste. But when it is given with madhu, so that will increases the palatability. As a digestant, Anupana, which acts as digestant and appetizer, when given with the respective food or the medicine. For example, Panchakola Paniya as digestant and Vrikshamla Paniya. So these Amla Varga or sour taste food or fermented products, which increases the motility. Hence, for the Panchakola Paniya, which acts as digestant, and Mustapaniya, which acts as appetizer, also digestant, and Vrukshambla, so which increases the motility. And vehicle. Here, vehicle means we can understand it as Anupana, which removes any barrier in Srotas or does Sroto Shodhana and allows main drug to reach the site. Also, it increases the bioavailability of the drug and make the drug reach the site in a body. So we have to understand like this. And synergistic action of the Anupana. Synergism means compound effect of drugs when used simultaneously. Mechanisms in which pharmacological effect of two drugs are greater than the effect of individual drug when they are used in a combination. This effect is important for understanding the different Anupanas told for the medicines. All Anupanas which enhances the property of main medicine or give the extra effect when administered with the main drug. So Rasnadi Kwatha is told as Anupana for Yogaraja Guggulu in Vatarogas. Here Kashaya augment the action of Yogaraja Guggulu. Also, the famous example we give Talisadi Churna with Madhu or honey. So here the Lekhana property scraping action of Kapha already resides in Talisadi Churna or Situpaladi Churna. But when we give with Madhu, the Lekhana property and Kaphahara property, so this will added more to the whole yoga. Hence, thus acts as synergist. And bioavailability. The drugs administered with Ghrata so enhances the absorption and bioavailability because biological membrane is a bilayer phospholipid and cholesterol molecules. And some of the Anupanas which are alkaline or acidic, so that it will balances the pH in the gut and aid in the absorption also. And when the particle size of the drug, when Anupana, when the main drug is administered with Anupana, so that will reduce the particle size and aid in the absorption. And in research studies, it is found that dissolution with the liquid or in terms Anupana decreases the particle size of the molecules of the drug and facilitates its transport. And some points. So here I have taken common food examples. Anupana, Himam Vari, Yava Godhuma or Hitam. So usually Yava and Godhuma, that is barley and wheat products, should be consumed with cold water because the gluten is present in these wheat and Yava barley. So this becomes hardened by the application of hot water. Hence, by giving with cold water, the increases the solubility and digestibility also. The cold water with curd. So usually while digestion, the lactic acid formation is mainly responsible for the heartburn, and curd taken with cold water which reduces the heartburn. Honey and cold water. So honey contains enzymes for easy digestion and absorption, and honey is acidic with pH ranging from 3.2 to 4.5. So honey should not heated. So when it is heated more than 40 degrees centigrade, the one chemical produces called hydroxymethyl furfural as well as more formation of peroxides, which has deleterious effects on the body. Honey is best at its natural form as it contains amino acids, vitamin C, D, E, K, and B complexes. So if we heat honey, it will change composition of nutrients, also chemical changes in honey. Whether to consume honey after heating is a tricky question because in Western countries, honey is extensively used for baking cookies or puddings or classical desserts, and it is commonly alternative to the sugar. It is not considered as toxic, but as per Ayurveda, it is considered to be toxic. In fact, the best way to reap the nutrition from the honey is to use it in its raw form. But if you still want to bake or cook any delicacy using honey, then make sure you do not overheat the honey. As more you heat, the nutrients of honey are lost in the process. And these are all the example for individual doshas. Here, the Anupana should have opposite quality to the qualities of the doshas. For example, Vata is Ruksha and Shita. Hence, the Anupana property should be oily and hot. And Pitta properties Ushna and Tikshna. So the property should be cold and sweet. So Anupana given in Pittaji disorders should have colder and the sweet taste should be sweet. In Kaphaja Roga, the Ruksha and Ushna Anupana should be given. So in Charaka Kalpasthana, we have many references, so that can be given in different dosha vyadhis or different vyadhis. Depend on Aushadhi. Hingvashtaka Churna. Usually, Hingvashtaka Churna is advised in indigestion. If you see attributes of drugs in Hingvashtaka Churna, that is Ushna, Tikshna, and Anulomana. So these, because of Ushna and Tikshna, this may cause gastric irritation, and hence giving with ghee, it reduces the chances of irritation, also mask the odor and taste of the asafoetida, which is residing in Hingvashtaka Churna. And Bhaskara Lavana Churna. So in Bhaskara Lavana Churna, we have 4 types of salt, and it has corrosive nature. So mainly it is advised for bloating and gas problem. The Anupanas here told with Bhaskara Lavana Churna is mainly having sour taste. So when sour and salt food is mixed, it will convert the sweet taste. Also, the sour drinks reduce the corrosive action of the Bhaskara Lavana Churna. And Indukanta Ghrata with Guduchi Swarasa. Indukanta Ghrata is used for intermittent fever. So Nimnonnatam Jwaraharam Balavardhanancha. So it is considered as Vishamat Jwara. So when Dhatu Bala is reduces, dosha will lodge in the Dhatus and Jwara becomes Jirna. So this will lead to Vishamat Jwara. So Guduchi, which is having best Avaranahara property, so will helpful to dislodge dosha, and when administered with ghee. Also the Indukanta Ghrata has Balavardhana property that will do the Balavardhana of the Dhatu. So that's why here the Acharyas very specifically told the Anupanas. So these are all the logic. We can see the different combination, why it is told. And Yoga Ratnakara lists drugs which are best or agriya for different diseases. For example, Jwara. Musta, in recent research, it is shown that it has antipyretic effect similar to the aspirin. So in Jwara patients, we can give kashayas of Kirata Tikta, Musta, and Parpata, and Grahani. Grahani, if you want to correlate Grahani, so that is we can correlate to IBS. Hence, the Takra, which is nowadays it is used as Takra means buttermilk. In recent days, it is used as probiotic, which is best for IBS patients. Likewise, the best drugs which either do the Samprapti Vighatana or do the main, which helps in mitigate the main symptoms of that diseases. So hence these are all the drugs told for each disorders, and depends on Rogi. So we have classified Anupana for Vadhita as patients based on patient's requirement or necessary for individual need. Here Krisha means a lean built person. Sura is a fermented product of boiled rice which has property of Brahmana, that is nourishing effect, weight gain effect, and Deepana increases the digestive fire, and also it reduces the Kasa, Arsha, and Grahani. So that will help the patient who is lean built. And Sthula, the Madhudaka, that is honey mixed in water. So here we have to remember that the water should be room temperature, in a room temperature. And if a person has lost his body weight because of different diseases or fasting or working under sun, also these patients can take Kshira as Anupana with food, or the children, also the aged person, they can also have Kshira as Anupana. And Niramaya, healthy individual. So Niramaya patient can have Jala, and it should be consumed with along with the food, not before food or after the food. Depend on Ahara Dravyas. We already have seen that Yava and Godhuma, barley and wheat, we should be consumed with cold water, and vegetables or soup prepared from green gram should be taken with buttermilk. Dhanyamla is a fermented product prepared from rice and black gram. And Mastu is a supernatant water liquid portion on the curd. and taila. So any oil should be given with soup prepared from green gram. Also, if patient is having ghrata, so he should have Ushna Jala as Anupana. Single drugs and Anupana. So here Guduchi in a different Vyadhis based on different Anupana. Single drug Guduchi is administered and Haritaki. So Rutu Haritaki changing with the different Anupanas told in different Rutus. Rutu Haritaki is considered as Rasaina. It helps to remove accumulated dosha in each season. It is a simple and cost-effective rasayana also. One study of 60 participants given with 3 grams of haritaki and 1 grams of saindhava lavana on empty stomach in Varsha Rutu, that is rainy season. Here it is found that it is effective in reducing the severity and frequency of the diseases which are very common in monsoon season, like cough, cold and fever. Also these anupanas which are having opposite to the doshas which may be accumulated in the each rutus based on the rasas. So here the one food is having one main rasa, then the opposite quality rasa should be given. Like for sweet taste food should be consumed with spicy taste anupana. Also the sour taste food should be consumed with salt taste anupana. And here the multiple anupana with single formulation. Here the examples are Kaishora Guggulu, Yogaraja Guggulu, Narayana Churna. These are all the famous examples given for multiple anupana with single formulations. The Narayana Churna, it is the purgative formulations. It has kshara, alkali, also salts. So if we observe here, all are amla rasa pradhana anupanas are mentioned, because when the salt food or alkali, when it is mixed with amla, sour taste food, that will convert to the whole mixture will convert to the madhura. Hence the corrosive nature will be reduced. What is the best anupana? In Samhitas, the best anupana is Mahendra Jala, that is rain water. But it is not in practice. So we can consider normal water as best anupana for healthy person. Because we use it regularly, means that is satmya from the birth. Anupana and time of the administration. Anupana, when it is, or if we think jala or water before food, what will happen? So that will dilute the gastric juice. Also, if we filled with stomach with liquid, then we can't have more solid food. Hence, that will lead to the weight loss. When the anupana is taken along with the food, that will maintain the overall weight of the body. And if it is taken after food, that will lead to the weight gain, because we consume more solid food. Hence, that will lead to the weight gain. And indications. So anupana is indicated for less active persons who are less active in work, who are having less appetite, and who is delicate, and who is always treated with pleasing things. And contraindicated. So the asthma patient, cough and diseases above the neck region, and the patient are having cold and hoarseness of the voice. So in these rogas, we have to avoid the anupanas. Contraindication after anupanas: walking, speech, learning, singing, sleeping. These things should be avoided in anupana. After taking anupana, anupana can be avoided. So if patient having more strength, or having dehabala and habit of eating dry food since birth, the person having good hunger or very active in work, so in this person we can avoid anupana also. So if we anupana given in contraindicated person, what will happen? That will do the pradushti of amashaya, and because of that the sthana samshaya of doshas, and these doshas will move to the uras and kantha, and this will lead to the disease of Kafasrava, Mandagni and Chardi. Prakshepa and Anupana. So Churna, Kalka, Shakara, these are told for different yogas. So here many Vaidyas consider that Churnas or Kalkas or Sharkara Guda is Anupana. If we refer the Samhitas, only the Pana means the drinks. So only liquid form. So here the Anupana is clearly only pertains to the liquid diet or liquid food, not for the hard mass or hard solid foods. Case example, these are all the simple case example I have treated based on Anupana principle. The case one, female patient aged 68 years. She is a casual laborer and complains of increased thirst and mild chest tightness since 1 month. Previous history, 1.5 months back, she had jwara, that is fever, and managed with allopathy medicine. After 3 days, she had fish sambar and started daily work. So because of this, the dosha which is that will become the jirna jwara, and rasa shosha is there, and reduced bala is there. So this is the diagnosis I have made, and the treatment principles. So what I have to do in this condition? So mainly dosha pachana in rasavaha srotas and ambuvaha srotas, and the treatment was Shadanga Paniya as Anupana with 3 meals for 10 days, and Ganji, the liquid diet, for 5 days for 3 times a day. The result, she got relief from thirst, tightness of the chest, and weakness. And case 2, the female patient aged 58 years, she was farmer, complaints of mild blackish discoloration around and below the right ankle joint since 1 month, and associated complaint was pain in right ankle joint. A history of varicose vein in bilateral lower limbs, more in right leg since 1 year. The diagnosis I made was Uttana Vata Rakta, and treatment principle was improving the circulation and avarana removal. So the drugs I chosen was Kaishora Guggulu with Guduchadi Kashaya for 40 days. Here Guduchi is also in Kaishora Guggulu, but I have taken Guduchi Kashaya because Guduchi is mentioned best for Vata Rakta. So Vata Rakta is Avarana Vata Vyadhi, and Guduchi will remove all the Avarana. Hence, and also it improves the microcirculation. Hence, I chosen Guduchi as a main Anupana, and the result, discoloration completely reduced, but the varicose vein was still persistent. Third case, the female patient aged 38 years, homemaker, complains of colicky pain in right upper side of the abdomen since 1 month, associated complaints of reduced appetite, altered bowel habit since 1 month. So USG, it is shown that grade 2 fatty liver. The diagnosis I made was Grahani, and treatment principle, the goal was Pittasthanagata Kaphamedo Hara. So hence the drug chosen was Arogyavardhini Vati and Varunadi Kashaya for 40 days. The result was after 45 days, the USG shows that no fatty infiltration. So my conclusion is that Anupana, which has a specific role in each context, in dosha, rogi, kala, that is season, and very specific to the different vyadhi or different diseases. By understanding logic behind each Anupanas, we can use Anupana in different scenario. And Anupana increases the bioavailability of the drug by altering pH of the GI tract. Also, multi-effect is obtained due to synergistic action of the Anupana. Hence, the suitable Anupana should be selected for different individuals and different conditions to obtain the maximum effect. Thank you.
Thank you, Dr. Sampath, for a wonderful presentation. Let's go for a little bit of discussion on the topic of Anupana. So you personally have mentioned 3 important cases that you have treated using Anupanas. My basic question about this topic is, which is most important? So after this particular session, after this your presentation, it seems to look like the Anupana is as important as the medicine or the ahara with which we are giving the Anupana. So it is as important. How important it is for an Ayurveda student to go through these Anupanas, to be well versed with Anupanas, because if we don't go with those Anupanas, the results may vary. So that is what the experiences from our Shastra, the treatises clearly tell. So how important, so we always emphasize and stress on the students to go through the Palashrutis and also know which medicine can be given in which particular condition or conditions, like multiple conditions. Now, after this session, another question raises how important it is to know about the Anupanas, or how important it is to insist on the students along with the medicines. Please remember with which Anupana you are giving that and with which it should not be given. So what's your take on this, and what's your tips for Ayurveda students, Dr. Sampath?
We have to understand each Anupana or each Dravya based on its Rasa, Guna, Virya, Vipaka. That is common to understanding for all the drugs. But it has one more that is attribute, it is Prabhava. So it acts on different diseases. But why it is acting in that way? Or we have to always question why it is these combination have made. So definitely we get answer in Sutrasthana. Usually all the food materials, their attributes are discussed in Sutrasthana of all the Brihatari, all the Samhitas. So if we well versed, not well versed, if we go through the Sutrasthana, we can understand the gunas of the drugs and gunas of the ahara, gunas of the Anupana. So that will help us to practice efficiently, sir.
Okay, thank you there, Dr. Sampath. So that I think that's a wonderful version of how important is Anupana. Your entire slides, around 40 to 43 slides, showing the importance of Anupana in our clinical practice. Yes, that is where we exactly want to open those Anupanas. So how easy or how difficult it is to convincing the patient to take the medicine and to go with the timer and take them regularly itself is difficult. But when there are some Anupanas which are very rare, so like the patient himself or herself has to prepare that Anupana and mix it with the medicine and take it every time they are taking. How easy or how difficult it is to convince the patients, especially the medicines, just ask them, take a pill, put it in the mouth, take some water and pop it up. So even when we tell in clinical practice, they should be taken with hot water or warm water. So the people may stare and give an expression. So every time, how do I prepare hot water? Can I take it with hot tea? Can I take it with hot coffee? There will be so many questions. So how difficult it is to handle the patients, and what is the responsibility of the physician there to emphasize, stress and tell that this is the medicine you have to take with this Anupana. Even you can point out how challenging it is as a doctor, as a physician, how it's a challenging scenario for you also to advise. Did you face any challenges or difficulties in convincing patients to take some Anupanas? If yes, how and what?
My experience in a hospital and what I have seen or interaction with the patients. So when we explain the what this medicine will affect in your body or in the how this will mitigate the symptoms or why this is necessary, if we explain in easy terms for the patient, and definitely they are going to follow that. So this is my experience. Or it is if it is having bitterness, bitter taste, in those conditions we have to highlight the importance or highlight the why this medicine is important for them or in that condition. So in easy words or in simple words, so when the patient understands, and then every patient will follow the diet or that medicine, they will agree to have that even the medicine, even though it is having bitter taste also, the once after understanding why this is important, so definitely they're going to accept or they're going to have that medicine, sir.
Did you find personally, did you find any difficulty in convincing any of your clients in terms of any Anupana? No, doctor, this is very difficult for me to take.
Till now, those kinds any experience I am not experienced, sir.
So seeing through the bioavailability and the synergy that you have mentioned in terms of Anupana. So we know that now Anupana is very, very important for most medicines. Now, what is the importance of this synergy and also bioavailability that also you have stressed while explaining the different Anupanas? Now, does it mean to tell that if seeing the bioavailability and the synergetic effect of Anupana, if we don't use the Anupana, is there a possibility that the medicine, the main medicine which we are giving to the patient, fails in its actions? Number one, or there will be lesser results than what we are expecting, or the bioavailability of the medicine may not be that good, that the patient may not experience that good results in comparison to when he takes those medicines with Anupana.
When we administered the main drug with Anupana, so definitely we get extra effect, that is synergistic effect. So as we discussed in with Talisadi Churna, the in context of bioavailability, yes, because in contemporary system of medicine they are having IVs, so directly they are giving, so the medicine directly available for the tissues, or that will reach the site within lesser time. Also the concentration of the drug that will be more, so if we administered through the IV. But the majority of the Ayurvedic drugs, so it is taken orally, so it should pass through the flora of the gastric, and it should pass through the layers of the digestive system. Hence, by administering with Anupana, definitely that will increases the bioavailability. If you don't administer it with Anupana, maybe there are chances of we can see the lesser effect of drug we can see, sir. Maybe
Absolutely,
chances are there.
absolutely that's exactly what I wanted to know. Like you mentioned, Talisadi Churna, so giving it with honey or hot water. So does it make that big difference without Anupana? I have personally seen in my clinical practice also. So we miss the trick of Anupana. We don't prescribe it with a proper Anupana. So then the results will definitely vary. So there is a big difference in the results what an Anupana can make. So in terms of giving positive results, that I have also seen in my clinical practice, that's exactly what you are emphasizing. So with or without Anupana makes it a big difference. So now seeing that the doctors, the modern day doctors, like not everyone, most people don't have too much of time to interact with the clients when they're having a rush outside their clinics. So they may miss out the trick of advising the Anupana, but I still insist that Ayurveda students should learn from this particular point of learning how to prescribe the medicines, how to prescribe them along with the Anupanas, the Sahapanas, because they are not just something which you mix and give it. It's not just for the reason of palatability, but it is also having a broad spectrum of clinical uses, especially in terms of results. The Anupana or the Sahapana can make a hell and heaven difference on how exactly that particular medicine or the formulation or the herb is acting. So that's a nice take, Dr. Sampath. So coming to a few questions from the question box. So like Prajnaji has a question for you. Doctor, can you please explain how to make Dhanyamla for consumption? So I know Dhanyamla is for external therapy. So people use Dhanyamla for external therapy most frequently. So the question is how to consume it. Is there a different method of preparation, or is it the same Dhanyamla which can be consumed?
It is the same Dhanyamla. We can dilute with the normal water, hot water, or we can, it will be usually sour taste, and it is difficult to take or drink. So we can dilute with the hot water. So that will help to ingest the or drink the Dhanyamla, sir. It is
So
the same preparation,
it is the
the
same.
same.
More dilution is needed for
Yes.
consumption. Prajnaji has, I think, a question there. Can Varunadi Kashaya be given if person has previous history of GERD, gastroesophageal reflux disease, with no burning sensation, and cannot tolerate sore because of trigeminal neuralgia, but has fatty liver, cyst, etc. So this is like a mini case itself, Dr. Sampath. So you have a patient of GERD, no burning sensation, and cannot tolerate sore things because of trigeminal neuralgia. Okay, so that's an area where you can skip it. So, and very importantly, the person is also having fatty liver and cyst. In this condition, can you give Varunadi Kashaya?
Varunadi Kashaya is having that is Tikshna properties. It is there, but it is not very Tikshna when we compare to the Katurasa Pradhana Dravyas. So definitely we can administer, sir. So before administer, we can see for 2 to 3 days, we can administer or we can advise for the patient, and we can see the Upashaya and Anupashaya in that patient, sir. So So before continuing for long term.
Okay, short term can be prescribed, and seeing what exactly happens, we can continue it. But there is
Yes.
no problem in prescribing Varunadi Kashayam because of fatty liver and cyst conditions are there. It's as well indicated, so it can be given. So here the point of concern is whether it will aggravate trigeminal neuralgia symptoms or not.
We can
Yeah, yes,
we can
Dr.
add
Sampath.
other medicine also, sir. But we have to see why the trigeminal neuralgia is there, because the condition is overall it is indicating that it is one is gulma condition. So if we put aside the trigeminal neuralgia word, so if we directly take that is headache or shirashula, also the patient is having liver condition, so we can directly correlate it to in gulma condition. So definitely we can give, sir. Chances of aggravating trigeminal neuralgia maybe not there.
Maybe not there. Would we like to add some Gruta or like a Varanadi Kashayam with Varanadi Grutam will form an ideal combination here?
Yes, sir. Yes, sir.
Or some Taila, so some Vatahara Taila, something can be added. Again, an Anupana can be brought into the picture.
Yes, sir. We can add Ghrita, sir.
Okay, so that's there. So it's an interesting case, Pradnaji. So I think that gives a little bit of clarification. So anyhow, Varanadi Kashaya are also prescribed in many conditions. We need to see here again. So if it is triggering, as Dr. Sampath said, if it is triggering the trigeminal neuralgia or not, the symptoms or not, so that needs to be observed. So if it is, if no other medicines are given in the combination, only Varanadi Kashayam is given, and if it is not going good with the patient, so then we can think of alternatives. It should go good. So seeing fatty liver and cyst conditions, the patient should be presenting with some high kapha and high meda conditions for sure, for which Varanadi Kashayam will be a targeted medicine, so we can give it. Trigeminal neuralgia as a symptom of GARD or as a part and parcel of fatty liver and cyst, whatever changes, pathogenic changes are happening in the body, if it is a part and parcel of the pathology, I think it should not be a problem. Unless we are directly treating only trigeminal neuralgia with Varanadi Kashayam, and if the patient is not tolerant to Varanadi Kashayam, if other medicines are not given to address, and only if this medicine is given on an experimental base, and if the patient shows intolerance, maybe we might have to think in that direction. Otherwise, it should be okay. So thanks there, Dr. Sampath. Yeah, Dr. Sandy Ji has a question, I suppose. Doctor, is there any contraindicated Anupana for any Aushadha in specific? Like for any Aushadha, any contraindications? Like do we find strong contraindications?
It is not mentioned. It's not directly, or we don't have any references. But it is clearly mentioned that the food materials, the Anupana, when we are giving with the food, so it should have the opposite quality for the food. But when we are administering with the medicine, so it should aid in the effect of the drug. So it is not, there are no direct references or examples, but we can avoid, for example, if we are going to given, for example, we are giving Kshara Dravya Pradhana, for example, Shatpala Ghrita is, we are giving Shatpala Ghrita, or we are giving Indukantha Ghrita. In those conditions, we can avoid Katurasa Pradhana Aushadhas. We can avoid those type of those medicines, sir.
Okay, so going with this question, Dr. Sampath, how exactly to find out if the person is okay with Anupana or Sahapana in that particular context? So you have prescribed a Ushnodaka or maybe a honey or maybe Ardhaka Surasa, whatever you have prescribed. If the patient tells that I'm not tolerating this, does it mean that the combination is not being tolerated, or the medicine is not tolerated, or the Anupana itself is not tolerated? If it is Anupana in this case, so take for example, we can detach, like you are taking something with Ardhaka Rasa, like ginger juice. So keep away the ginger juice and just try to take the medicine with something else, and the person is compatible with that. So how to look at these things? So whether it is the medicine or the Anupana or the combo which is not tolerant for a given person, and how to handle that?
In Shastras, it is mentioned as we can give. So it is in specific conditions, when these specific combination is given, then the result will be good, or we get good result more. So that's why these type of combinations have been made. So if patient is not tolerating those kinds of effects, then definitely we can avoid those anupanas and we can change the anupanas, because always it's responsibility of the vaidya, and also it has the vaidya has freedom to change any anupana, so we can change the anupana.
Absolutely. That was my next question also, Dr. Sampath. So, can it be a yukti-based practice? So, all anupanas have probably not been suggested in the text. Knowing the concept of a disease, the samprapti of a disease, the dosha involvement, their behavior, how they interact with the aushadha, and also anupana. So, can we make our own combinations of a medicine and anupana in our clinical practice after understanding the basics and fundamentals? So that would have been my question. You have answered it already. So thank you for that. Dr. Manjushri ji has a question for you. Any must-use anupana you practice in skin diseases? So like Dr. Sampath recommends this in skin diseases, anupanas like that.
There is no recommendation, sir, because always each condition is different. So we have to analyze different aspects like dosha, dusha, and all. So not sticking to the one anupana. So if we observe the condition, why, and if we take history correctly, so we can use very single drug formulation also we can use. Also we can change the medicines also. So we can't stick to any anupanas, because that will mislead. Because if I told this, take this anupana, because after that the condition varies, and we have one condition, ashayapa karsha is also there, because in ashayapa karsha the vata which takes the different doshas in different parts. So we have to understand avarana concepts and ashayapa karsha concept. So different condition is there. So after understanding the nidanas, the causative factors, then we have to decide the medicine that would be very suitable to the patient, and which is ethical practice also. My opinion.
Okay, you would open telling after the choice of the medicine is made, only then we will decide the anupana.
Yes, sir. Yes.
Okay, so they go hand in hand, and once you are pretty much sure which type of skin disease or which type of kushta is it, as Dr. Manjushri is asking, only then we will go with the anupana. But still sticking on with that question, just name a few anupanas which are really awesome in Tvak or the kushta, without considering which type of kushta it is, like Mahakushta or Kshudra Kushta. We will not go into the depth of those things. Which are the best anupanas which can be given in Tvak or kushta?
So when the oozing condition and kandu, or that is the kandu is more. So in that condition, the kaphaja condition is more. Then we can definitely advise Aragodhadi Kashaya as anupana with Yogaraja Gugulu. Also in discoloration aspect, if we come to discoloration aspect, we can advise Manjishtadi Kashaya or Mahamanjishtadi Kashaya also. And as a rasayana, so Tuvarka rasayana is it is well known in skin diseases.
Absolutely. So thank you there for those small examples, Dr. Sampath. As again you mentioned about Gugulu, Kaishora Gugulu, we know that it acts in Kusta, it acts in Vatarakta as well. With different anupanas, it yields totally different results. Giving it with Argodadi Kashaya or Khadira preparations, or with some other preparations like Manjishtadi Kashaya, so can make a lot of changes in the results with the same medicine gives. Having touched upon a beautiful aspect you touched in your slides is single formulation and multiple anupana. So that is quite awesome. So that's where the students also have to focus. So single formulation, multiple anupanas like Narayana Churna, I mentioned, Dr. Sampath. So many such formulations would make clinical practice easy, because you are having only one medicine like a Narayana Churna, and you have 8 different or 10 different anupanas with which you are giving, which can cure 8 to 10 different spectrum of diseases. Should it be the tip of the day or a tip for the Ayurveda practitioners? No such formulations which go with many anupanas and can cure many diseases. Have few drugs or few combinations in your clinic and have a successful practice.
Yes, sir. Also, it is like joyful for us also, because having limited number of medications and with changing different anupanas, definitely applying logic and why the applying and understanding different conditions and giving different anupanas for single medicine, definitely it's a joyful journey, sir.
Thank you. So knowing that knowing itself is knowing and believing itself is a practice, isn't it, Dr. Sampath? Like we know that I have 1, 2, 3 formulations in my rack in the clinic there, so and I can handle 15 to 20 diseases or different conditions. Having just these 3 formulations will just fascinate us in how we practice. So diagnosis very importantly plays a very important part here. So diagnosis of the condition and seeing through the gatakas, as you said, Samprati gatakas, dosha, doshya, desha, kala, a lot more things before administration of medicine, the choice of medicine and Anupana. So diagnosis comes as a very important tool there. Dr. Sampath. So my question was, diagnosis is the key tool for the choice of medicines and also the Anupanas, be it dosha pratyanika or vyadi pratyanika.
Yes, sir. Yes, sir. So we have to understand. We have to understand those
multiple facets of the disease and also the diseased. So right there. And coming to Sandyji's question, we have a couple of questions before we wrap up. Same importance given to Anupana in patent and classical medicines. This is a very important question, I feel. Anupana should be considered in patent prescriptions also, or only in classical medicines, because we know that they have been mentioned in the classical preparations. So what about the patent medicines?
Once we understand how the medicine acts, sir, so definitely we can choose it as Anupana, sir.
Okay, the ingredients in the patent medicine as well has to be seen, and later we can judge with which Anupana it goes well.
Yes, sir.
Thank you there. So Kavita ji asks a question: a person with obesity and heartburn, how can we give Nauka Gugulu but Varunadi Kashayam without increasing pitta? So there is obesity, there is heartburn. The prescription medicine is Nauka Gugulu, both Nauka Gugulu and Varunadi Kashayam without increasing pitta. How do you prescribe?
We can administer food after food. We can administer the medicine after food. We have to see what is the effect after administering the medicine after food, because usually the kashayas and these lekhana dravyas usually administered on empty stomach. So we can administer after food, so that will reduce these kind of symptoms.
Okay, Aushadha Sevana Kala and also the mode of administration also comes into the play there.
Yes, sir.
Thank you, Dr. Sampath. So there, Sandy ji, can honey be given as Anupana in diabetic patients? Important question, many.
Definitely, the most important point is, sir, nowadays the honey is mixed with many adulterants. So we have to check the purity of the honey. So if the honey is pure, definitely it is advised for the diabetes patient, sir. Also diabetes patient we can administer. Okay, if the patient is obese, we can administer, sir.
We can prescribe. So seeing that the diabetes falls into the group of the prameha, and also the prameha kapha krutya sarvam we have. So kapha is the main positive legend dosha behind almost all the pramehas before they manifest in the form of kaphaja, pittaja and vataja, and ultimately into madhumeha, and madhu being the best medicine for the kapha related disorders. So in mild to moderate cases, and also in as you said, in obese patients who are also diabetic, and in selective cases we can go with madhu. Madhu is prescribed so even in the diabetic conditions. So what is diabetes and how do we translate diabetes, that particular stage of diabetes, into the Ayurveda this one understanding? So that all depends whether we are going to use honey in that particular condition or not. So that's a big question. How do we translate a particular presentation of diabetes into the Ayurveda understanding? So then we can decide if honey can be used or not. So people are also apprehensive. So people have many queries related honey and diabetes. As I said, it is the topic of a big discussion. So thank you, Dr. Sampath. So a couple of last questions before we wind up. Sir, kashaya can be given as Anupana in Rasaushadhas?
Usually the Tikshna Amla Dravyas, which is contraindicated for Rasaushadhis, like alcoholic preparations, those kind of Aushadhas usually contraindicated with the Rasaushadhis. But if we are considering only kashayas, so made of usually plant plant-based kashayas. So definitely we can administer. We can prescribe.
Okay, thank you. So at the end of this particular session, I would like to extend my cordial thanks to all the participants of Easy Ayurveda for being wonderful audience as usual, being here and supporting us, whatever condition may be, and indulging in healthy interactions with very good questions and making these sessions more meaningful. And on behalf of all of us, Easy Ayurveda family and our participants, a big thanks to Dr. Sampath Nayak. A big thanks, namaste, and lots of love from Easy Ayurveda. Thank you.